ALS is a life-changing diagnosis for 35,000 people every year in the U.S., and UC San Diego is providing some of the leading research. Joining me now to talk about some of the advancements here in San Diego, we have Dr. Dominic Ferrey, a neurologist at UC San Diego Health. We want to thank you, first of all, for being here.
Oh, it's my pleasure. Thank you for having me.
I mean, 35,000 people each year just in the U.S. alone. And we've seen some celebrities deal with Lou Gehrig's, right? And so what is it about ALS that is truly concerning?
Well, one of the biggest challenges with ALS is that it's very debilitating. It's a progressive neurodegenerative disorder where you lose the ability to move your muscles. It starts in one spot in the body typically and kind of progresses throughout the body. And unfortunately at this point, we don't have a cure. We don't have a way to stop this disease.
Okay, and the way that it's treated has changed over the years. We've heard about ALS for a very long time. So you have to talk a little bit about what you guys are doing over at UC San Diego Health.
Yeah, I think we have an exceptional multidisciplinary care clinic at UCSD. So something that we really excel at is working together with our team members. That's not just me, the physician, but we have multiple therapists and other support staff that work together to take care of the patient as a whole. They come in, typically our patients are coming in quarterly, and we evaluate their needs and try to take care of them holistically.
Okay. Oh, holistically?
Yeah.
So talk to me more about that.
Well, we have just people evaluating from all kinds of different aspects to support their care. So we have respiratory therapists who evaluate their breathing. We have nutritionists who help support their diet. We have speech therapists, occupational therapists. I work closely with some of our pulmonologists as well. And so we're just trying to take care of all of their needs to help support our patients.
Okay. And what has the reaction been from some of the patients?
Well, I think they really appreciate the care that we offer. You know, we do the best that we can to try and meet their needs and meet them where they are. And we're not just trying to support them, we're also trying to find a cure. I mean, we work very closely with many of our industry partners, and we have a robust clinical trials unit that's integrated in our ALS clinic, where we can talk about different clinical trials that we can offer for our patients.
Sure. And for viewers who may not know exactly how ALS works, what are some of the warning signs we could be looking for?
Absolutely. So ALS typically presents as a progressive loss of strength. It's not usually painful, and there isn't usually numbness associated with it, but it tends to start in one spot in the body for each person and spread throughout the body. Now, where it starts is very variable, so it can be different for each person. So I would say if someone's having progressive loss of strength, sometimes they can have muscle cramping, twitching, then they should really need to go get evaluated by their doctors to see what else could be causing this. Yeah.
Do we know at all about the cause? Is it genetic?
Yeah, so about 10 to 15% of ALS can be genetic, but that leaves a pretty large chunk that's not genetic. Amongst these people who don't have a genetic cause identified, there is a shared kind of pathology, but we don't know what kickstarts it or why it gets started for these people.
Okay, and I'm assuming that's probably also one of the reasons why it's hard to find a cure too.
Yes, it looks very different for each person because the underlying process is similar, but where it starts and to what degree is very different. So for somebody, it might start with weakness in their leg, or it might start with weakness in their hand, or somebody else, weakness in their speech or swallowing. And so it can look very different. Sometimes that leads to delays in diagnosis as we're trying to kind of tease out exactly what's causing it. But then it's hard to measure as well because of how it's evolving differently.
So I just suppose if you have any questions or you're concerned about something, always just go to your doctor and figure it out that way, right?
I think, you start with your primary care doctor, and if there's concern for a neurological issue, they'll refer you over to the neurologist, and then that's kind of typically how these things will get sorted out.
Oh, the work that you do, Doc. We do appreciate it. Thank you so much for being here and talking to us.
Appreciate it. Thank you.
Thank you.